Thank you, Chris. Good afternoon, and as always, we appreciate the media getting our message out, and so we thank you for that. I'll start with a couple of quick updates. As of this morning, Northern Light Health is taking care of 12 individuals in our hospital who are positive for COVID-19. 7 of them are at Eastern Maine Medical Center, 4 are at Mercy Hospital, and 1 is at Inland Hospital. We also have 6 individuals being cared for at home by home care and hospice as well. Quick vaccine update. So far, Northern Light has administered a total of 88,825 doses of vaccine. This represents 58,454 first doses and 30,371 second doses. We continue to prioritize those individuals over the age of 60, as well as fulfilling the President's initiative to vaccinate workers in schools and licensed child care workers, as well as continuing to vaccinate healthcare workers, first responders, and other critical workers. I'd like to start by noting that despite 2020 being a year that many of us would like to forget, there are many things worth remembering, including the healthcare and community heroes who showed courage, strength, and perseverance during unprecedented times. We witnessed amazing acts of compassion and caring, and as such, we've dedicated our 2020 annual report to our healthcare heroes. The report was just released a couple of hours ago and can be viewed at northernlighthealth.org/annual report, no spaces. There are inspirational stories about heroes on the front lines, heroes behind the scenes, and heroes in the community, and how each has played a powerful role in this response. I encourage you all to check it out. A quick update on vaccine sites. Our vaccination sites continue to operate smoothly. I have a couple of updates to share on sites that will open soon. The Piscataquis Ice Arena in Dover-Foxcroft is just about ready to go, and we're on track to open this Friday, March 19th. Some of you may have attended our recent media walkthrough on the site. Our goal is eventually to reach 1,000 vaccinations each week at that site. Also located in the former Family Dollar space on High Street, the Northern Light Health Hancock County vaccination site will be a joint program offered by Northern Light Main Coast and Blue Hill Hospitals. Between 500 and 750 vaccinations will be administered each day once it is fully up and running. We expect this new vaccination site to open on or around April 1st. The current vaccine site at the Main Coast Hospital will close once the new site launches. However, Blue Hill Hospital's small site within the hospital will remain open for now. Our top priority at our vaccination sites is to provide the safest, most convenient, patient-friendly experience to everyone who walks through our doors. One of the ways that we do this is by restricting the number of people who enter the sites. While we encourage accessibility partners and guides to accompany patients inside when needed, we need to be cautious about having children under the age of 16 in attendance. For their safety and others, if child care can be arranged and provided, we ask that you assist us in that and leave your children at home if possible. And with that, I'll open it up for questions.
Thank you very much, Dr. Jarvis. I did fail to mention the order that we'd be taking questions in, and so we'll go in this particular order. David Marino from Bangor Daily News, Ellis Keefe from WMTW, next Brian Sullivan from WABI, Eric Russell from Portland Press Herald, Chris Costa from News Center, Maine, and then we'll have, I believe it's TJ from ABC 7 Fox Bangor. So David, it looks like we'll start with you. Just give me a second to make sure that you're unmuted, and then please ask your questions. Okay, David, you should be able to unmute now.
Thank you, and thank you, Dr. Jarvis. With Governor Mills moving up the age eligibility for vaccines, is Northern Light prepared for increased demand at the Cross Center when the general adult population becomes eligible to be vaccinated on May 1st?
So yes, that's a great question. So will we be able to meet the demand once we have the age restrictions removed, most likely on or around May 1st of this year? And the answer is yes, of course. Right now, we particularly have vaccine as our limiting factor. The Cross Center could be opened up more days of the week or extended hours if need be. So we feel that we can meet the challenge, but not only here at the Cross Insurance Center, but at all of our clinics across the Northern Light Health spectrum. In particular, the 2 new clinics that I just spoke about, the Piscataquis Ice Arena and what will be the Hancock County large-scale vaccination, are set up just like we did at all of our other sites so that they can be expanded if and when we have the vaccine and the need to do so.
And I was wondering if there had been any security incidents or anything inside the Cross Center vaccination site since it opened, and how would those be dealt with if there was to be? There's no private security there, is there, or would it be police, or how would it work?
So first and foremost, I want to say we have not had any issues of any great consequence since we opened our doors, which is great news. And again, I think it stands to the character of people of Maine. They understand that they are here for a particular reason, and that reason is to protect not only themselves, but to protect those around them and their community. And so, overwhelmingly, the mood is joyous and thankful. And we expect it to be that way. From the beginning, not only here at the Cross Insurance Center, but our other sites, we do have on-site security. Here at the Cross Insurance Center, our partners with the Securitas firm are on-site, as well as the Bangor Police Department. And so, we do have a presence here if need be, but right now I think just the kindness of everybody has really played through, and have not needed anything more than maybe a frank reminder to wear your face covering while you're inside.
Hey, thank you very much for your questions, David. I believe WMTW is next. I'm just trying to look for you, Alice. Oh, there you are. Alice, you should have permission to unmute now. Go for it.
Hello, two questions for you today. My first question is, as more people here in Maine, as the more people start to get their vaccines, what do we know about when we may need to have booster shots? How long did the antibodies that we know of at this point last in the vaccines that we have, and is that the same as how long those antibodies last in people who have had COVID?
So that's a great question, Alice. So I'll preface with the data is still coming in on all of those. We do feel that the immune response and the longevity of that immune response to the vaccine is greater than from natural infection, and we have some data to support that. Most people's antibodies wane after about 90 days after being infected with COVID. However, as we start to have people who have been vaccinated longer than that period, it appears that we'll have immunity at least for up to 6 months. Again, not 100% clear on that, but that's where it looks like we are headed right now. If you look at the CDC's guidance right now, they continue to talk about that 90-day post-completion of your vaccination period, that they feel that travel and things like that are safer. And I expect that shortly we will hear them expand that out from 90 days to somewhere around 6 months. As far as booster shots go, I'm in the camp that says that at some point we will need to get booster shots. We know how coronaviruses in general work, and that people's natural immunity to coronaviruses wane rather quickly after the infection. And we've certainly seen that with the coronavirus that causes COVID-19. It remains to be seen whether or not the vaccine will give us a year or 2 or 3 years worth of immunity. That'll be data that we'll see coming out. But I certainly am one that thinks that at some point we will get to where we will need to get booster shots, and I think that will be annually, much like we do with the influenza vaccine.
Great, thank you. And then my second question is, over the next several weeks here, we're going to see restrictions in Maine continue to loosen. On the other hand, more people are getting vaccinated, but still restaurants and other things get to have more people inside at one time. Do you expect that, from what we've seen in other states and what we're seeing here in Maine, do you expect to see a type of third wave or a rise in cases once things loosen up a little bit, whether that's just for a short period of time or, what are you expecting to see when we get to that point in the next few weeks?
So there is still some predictive models that talk about in Maine a third wave, and for the rest of the country a fourth wave, coinciding somewhat with recent vacation time, early spring break or winter break travel, as well as the concern over those variants that are more infectious than the one that was the predominant strain during the summer and fall months. Again, with everything with COVID, predicting what's going to happen is always difficult. I am cautiously optimistic that as we get more people vaccinated and we see our case counts continue to lower, that is good news for us. But it only takes one individual who's infected to be at a large gathering to cause an outbreak, like we've seen unfortunately too many times in the state of Maine, where that's exactly what has happened, and then all of a sudden we're back to those numbers that we saw before. I remind people that the numbers that we see today are still similar to the numbers that we were seeing in late September and early October, that all of us in public health were very concerned about. And unfortunately, we saw what happened in November and December, where our case counts and our hospitalizations and deaths skyrocketed. We don't want to see that happen. So again, words of caution. Even if you've been completely vaccinated and it's been 14 days after you've completed a series, you still need to be careful and wear your mask and remain socially distanced when out in public. It's very important that we continue to do that. And of course, those who are still waiting to be vaccinated, it's even more important for them to do that. This is the time when we have our chance to get the virus completely under control, and that can only happen where we all work together. So thank you for the question.
Thank you very much, Alice. Next up is Brian Sullivan from WABI. Brian?
Thank you. I have a couple questions about your sign-up system, and then one about the new clinic in Hancock County that's coming. As the May 1st date comes, I wonder, Dr. Shaw talked a little bit about eligibility and then availability being different things. Will there be any sort of, for Northern Lights sign-up system, a tiered time where people can sign up for the vaccine, or is it just going to be whatever's available if you're 18 years old or you're 41 years old, first come, first serve? And also, when the change comes more specifically in April, when will people 50 and up be able to actually sign up for the vaccine? How far ahead of April 1?
So Brian, I can't tell you about specifics about how the state is going to ask us to do rollouts. I do not believe they're going to ask us to have special clinics for certain age groups once the age restrictions are removed from eligibility. I think it will be a first come, first serve. As far as the way Northern Light Health will proceed, I expect that we will continue our process like we have been, which is that we open up scheduled appointments when we know that we will have vaccine on site for those appointments. We do not want to ever have to cancel because a vaccine supply is late or doesn't arrive or has some other issue with it. We continue to hear stories around the country of people who have waited weeks to get their vaccine. They show up and the clinic is closed. We have not had to do that, and despite bad weather, despite production delays, we have always been able to promise that if you have a scheduled appointment, we have vaccine on site, and that's the way I want to see us go forward. Obviously, we still work at the discretion of the governor's office as well as the federal government, and so if they were to change their process, we will welcome that change. But right now, I see us just continuing what we've been doing, which is to launch new scheduled appointments on Monday and Wednesday afternoons at 2 p.m. If we expand that out to another day, we'll let you know with as much advance time as possible. But right now, we'll just continue on that Monday, Wednesday scheduling process. This is a great opportunity for me to say that we do have appointments available for next week. So if you are in the category of age over 60 or are a school worker or a licensed child care worker and you are still needing to get your vaccine, please visit our website. There are appointments around the state for next week, and so please, we want to see all of those filled. We are here ready and able, and as we expand out eligibility, we will be ready and able for those individuals as well.
And just a little, when does the eligibility window expand on the Northern Lights system? When will people 50 and up, like when it was 60 and up and the change happened? I have a coworker who was able to sign up a few days in advance, so I'm just wondering when that happens. And then if you could just explain a little bit more about the upcoming Hancock County facility and the work that's being done there.
Sure. So, our website, we're dependent on our web designers and the ability to change things. It's actually relatively easy for us to change when the state changes their age eligibility. It was a little more complex when we had to add eligibility for school teachers and child care workers. And so we tend to try to meet what the state's goals are. If we're off by a couple of days, it's usually because of the way a programming issue works, so that we're not having to shut our site down for any long period of time. But again, as we get closer to a time when that announcement is made, we'll certainly keep everybody updated as to what our capabilities are. I don't have any further details on the Hancock County site, just to say that we are in the planning stages. It will follow a similar process to the process that we use at the Cross Center, at Kennebec Valley Community College, at Northern Maine Community College, the Ice Arena, the Expo. So it'll be a very similar process. Again, for me, it's all about efficiency, trying to vaccinate as many people as we can in as safe and comfortable environment as we can, and we have replicated that as we've built all of our large-scale vaccination clinics.
Thank you very much for your questions, Brian. Next up, we're going to Eric Russell from Portland Press Herald.
Thanks, Chris and Dr. Jarvis. I had two questions. The first was similar to what was asked earlier, and it had to do with this sort of stubborn leveling off of cases that we're seeing. And the data suggests that it's being driven largely by younger people who may be not at the highest risk of hospitalization or death. As we go a little bit further into this, and as more people who are at high risk are vaccinated, should we be thinking about case counts or daily new case counts in the same way, or can we look at them a little bit differently given that fact?
Yeah, I think we certainly look at things a little bit differently. It is great news that we are seeing that the effects of the vaccine have limited the number of outbreaks across the country in long-term care facilities such as nursing homes. That is wonderful news, but we do know that they continue to happen. And so we do need to be protective of all of those people. And if you think about it, if it's the younger people right now who are infected and being the cause of spread, and yet they go and visit their grandparents or parents in a long-term care facility, that's just one step away from an outbreak occurring. And so again, we have to remain cautious, but it is good news that things are happening. Many of you who have been on these with me, know that I typically am a little bit more pessimistic than I've been over the last few weeks, because we have seen some very positive news. But then I see, the people who are going on spring break and other travel, and I am concerned that they will bring virus back to the state of Maine, including variants that we haven't seen before. And so we just need to continue to watch that. That's why I continue to focus in a lot on both the positivity rate from our tests and the number of individuals who are symptomatic who are being tested, as well as our hospitalizations. Those are the key numbers for me that tell me about what's going on in the state from a severity standpoint.
Thank you. And the second question I had to do with vaccine hesitancy. And I wonder if you can provide maybe an update on, opt-outs within the Northern Lights system, but also not just among staff, but among maybe some of your patients as well. How are you reaching out, or how is your staff reaching out to people who may be still unsure about whether they want to get vaccinated?
Well, I think this is a great time when we really need to exploit that, what we've always called the doctor-patient relationship. I have my own panel of patients, and in fact, I have seen many of my own patients come through the Cross Center to get vaccinated, and that's just wonderful for me. It's heartwarming, and I think for them it's a little bit of trust in who their provider is, and I think that is a great way for us to address hesitancy, is for people, if they are concerned about either side effects or long-term effects or safety, to reach out to somebody that they trust who knows what it is that they're talking about, because they are part of the scientific community and they are looking at the data. I also think it's important that we reach out to members of our community who are viewed as community leaders, and you've seen that across the state. And in particular, I will give a shout out to our colleagues at Mercy Hospital, who engaged community leaders to go back to their community and say, hey, listen, here's what the facts are about these vaccines, that they are very safe, that there are very few side effects, and even the ones people get are usually limited to only 24 hours, that there are no long-term consequences of these vaccines, and most importantly, they are incredibly effective in preventing severe disease, hospitalizations, and death. And that's the reason why we have to get them. Again, when I talk to people, I say, ask yourself who is the most important person in your life. And whoever that happens to be, that's the one who you're getting vaccinated for. We're not all getting vaccinated for ourselves. We're getting vaccinated for others. I have shared before, for myself, when I got vaccinated, it was to help protect my patients from me. But I also have a daughter who's a cancer survivor, and I needed to protect her as well. And so when I talk about getting the vaccine, yeah, it's great for me to feel more comfortable when I'm out and about in the community, but it's much better for me to know that when I go home or when I'm seeing my patients, I'm protecting them as well. So again, it's that plead out there. Think about the other people in your life. Think about your circle of community. Those are the ones you're being vaccinated for. So thank you for that opportunity.
Thank you for the question, Eric. Before we move on to our next media member, we probably will have a little bit of time at the end of this any of you have a follow-up question that you wanted to ask, put it in the chat window. And once we wrap up our first round, I'll get to those and ask Dr. Jarvis for you. It appears that we just have Chris Costa from New Center, Maine up next. It looks like TJ from Fox Bangor has already had his questions answered. Some similar ones that some of you have asked already.
I'm always thinking about what
Chris,
TJ's going to ask.
There you go. So, Chris, as soon as you can see that you're unmuted, please go. Or unmute yourself. Yep.
Dr. Jarvis, can you hear me okay?
I can, Chris.
Okay, excellent. Hey, I just wanted to check in to see if Northern Light Health has any plans to expand its vaccine clinics in the Somerset County or Oxford County areas. I know there are some already existing and wasn't sure if Northern Light Health plans to open more or either increase the capacity or something like that.
Yeah, so right now we're not looking to open any more than the ones that I've specifically talked about, but increasing capacity is something that we discuss on a regular basis, and particularly at the Kennebuck Valley Community College site that we run. Particularly that site looks to expand both in hours and capacity. I know there was a group down there yesterday doing a little bit more fine-tuning work to adjust the efficiency in that particular location. Again, all of our sites have the ability to expand out. It really comes down to vaccine and staffing.
Okay. And then we talked briefly about the appointments you guys have available, that there are appointments available at your locations. Have you started to notice any change in the interest for appointments and the number that are available? I guess kind of what I'm getting at is, are there more available appointments? Do you wish that they were getting filled more quickly? What's the scenario going on?
Yeah, that's one of those double-edged kind of questions. When we fill our appointments so quickly, we always get complaints that we didn't have enough appointments or the access was poor. But for me, it's about not having any open appointments. We have staff and vaccine. When we have an appointment that's open, that means there's vaccine available for that appointment. And so I don't want to see any open appointments because I want to see us get back to normal as quickly as possible. And the only way to do that is to vaccinate as many people as we can as quickly as possible. The state of Maine continues to do very well in vaccinations and is particularly doing well in second vaccines for the Pfizer and the Moderna shot, so that's important. We also know that in April we're expected to get a larger supply of both those two vaccines plus a significant increase in our Johnson & Johnson supply. So we know that there is vaccine going to be available to us. For those who can't make an appointment now, I just ask for patience. Things will get better as we head into April, and especially if in April we lower the age requirement down to age 50 and above. We should not be at a time now where anybody who wants a vaccine is struggling to get it. There are vaccines not just at Northern Lights clinics, but at all the clinics across the state. At some point, it may be that you have to drive a little bit, or it may be at a time that's not as convenient for you. We know that as we come down in age, those weekday clinics are a little bit more difficult when people are working. But again, I would say if you have the ability to leave work to get vaccinated, please do so. It's just so important that we get everybody vaccinated as fast as we can.
Hey, thank you for those questions, Chris. Dr. Jarvis, I have a few more questions for you. I see one from Eric Russell, Brian Sullivan that are in the text box. I'll read those to you. And then I also see that Alice, you have one to ask from MTW. I'll get to yours after I read these ones off. So the question from Eric Russell from the Portland Press Herald, is there any updated data on vaccination rate among Northern Light staff or opt-out rate?
Yeah, I don't really have that data right in front of me. I will say that anecdotally, we continue to see workers who were offered the vaccine initially, who for whatever reason, whether it was a work schedule, a personal preference, or whatever, declined, coming forward now and saying, hey, I'd want to get my vaccine. In fact, I had several of our own healthcare employees come through the Cross Center this week to get vaccinated, some of them in that same situation. So I think that's good news. And we're seeing that out in the community as well. It's certainly what we've seen across our nursing homes, where people now look to their colleagues who've been vaccinated and realize, hey, they did great. And I want to do my part and get vaccinated as well. And so I think we're seeing that uptake. I will say that it looks a little bit like maybe that age category of 60 to 70 is a little bit more hesitant than the category of 70 and above. But we continue to have great numbers coming through all of our clinics. I believe we'll do about 2,300 to 2,400 at the Cross Center alone today. And if you look traditionally, we're doing high volume vaccination every day across the entire state of Maine.
Okay, and from Brian Sullivan from ABI, how does how do you view the Johnson and Johnson vaccine being used? Do you see it as a help for getting to harder to reach rural places where a single trip would be best?
Yeah, I think it's going to be everything and everything. I think we'll see that vaccine be used trying to get out to our more rural communities who don't have hospitals located nearby, so difficult to set up a vaccine clinic with the Moderna or the Pfizer. I think that we'll see at least some eligibility for it to be given at private practice offices. And then I also think that we'll be able to use it at our hospitals for inpatients, much like we do with influenza, where we try to vaccinate people while we have them in our hospitals before they get discharged home. So I really think Johnson & Johnson opens up a lot of avenues for us, but that will not displace the need to continue these large-scale vaccination clinics for the time going forward, simply because we're very good at using the Moderna and the Pfizer, and also just from a volume standpoint. Again, we can put many more people through one of our large-scale vaccination clinics than we could ever reach by going from home to home.
Okay, I got two more questions for you, Dr. Jarvis, and then we'll have to wrap things up at that point. Chris Costa from News Center, Maine. Have you noticed any instances of people who have been vaccinated later coming back to the hospital with COVID-19?
So we have had a few individuals who have been vaccinated who we know have become positive. Many of them had not actually finished out their series, so they actually became positive in between their first and second shot. It's not a large number. This is to be predicted. First of all, we know that you don't reach full immunity until about 14 days after you've finished. So that would be the 2-shot series for Moderna or Pfizer, or the single shot for Johnson & Johnson. So 14 days after completing that. And so there is the ability to get infected during that time frame. And again, as we've talked about, no vaccine is 100% effective. The good news is when we look around the world for all 3 of these vaccines, they seem to be extremely effective in preventing hospitalizations and death. And that's what our major endpoints were when we were conducting those studies. So I don't think we're going to see people who, after they've completed their series, we're going to see many, if any, individuals who are actually needing to be hospitalized.
Okay, thank you very much for that, Dr. Jarvis. WMTW, Alice, I think you had a question. This will wrap it up for today. So, Alice, why don't you ask your question?
Yes, just one question about the J&J vaccine. I know that we've all heard stories about people who've gotten their second dose of Moderna or their second dose of Pfizer and have, felt pretty crummy for a few days after. Is that something that you guys have seen or heard with the J&J vaccine as well? Obviously, it's only one shot, but do potential side effects seem to be less, seem to be the same? Just kind of wondering your perspective on that.
Yeah, so we have not had enough Johnson & Johnson come to the state of Maine to come up with our own thoughts on that particular vaccine. But when you look at the data that they presented for emergency use authorization, the side effect profiles were almost identical to Moderna and Pfizer and Johnson & Johnson. And again, that's no surprise. The technology used for each of those 3 vaccines, we were aware of what their effects are. We know that all 3 of them create a significant immune response, and oftentimes the side effects people have are actually just a result of their own immune system. So we don't expect there to be much of a difference between Johnson & Johnson and the other 2. Again, for my own and Northern Lights experience, it's been very limited with Johnson & Johnson, so we'll probably know more about that towards the end of April after we've been able to give more of that particular vaccine.
Okay. Well, thank you all. I think that's going to wrap up our virtual media briefing for today. Again, if you haven't already and you want the high-resolution video, please indicate in the chat box before you leave. And Dr. Jarvis, I'll let you have the final word.
Once again, thank you all. The weather's getting warmer. It feels like spring, and spring is always that hopeful time of the year. And with the vaccine, I think we can all be a little more hopeful now.